Hello to you all. I am introducing myself. I am Paulo with all the positions we mentioned before, and also the Global Center for South-South Cooperation. I'm a medical doctor. It's a pleasure to be able to present today's class some ideas so that we may discuss them either, or at least for the ideas to feed the discussion throughout the course. It is very important that we are together for the implementation in our country of the Agenda 2030 and the objectives of sustainable development. It's an international agreement that all our governments and also civil society and international society in our continent and worldwide. The class today will refer to the Development Agenda 2030 and the objectives of sustainable development. The global agenda has more or less been there for 35-40 years. The United Nations were created in the 40s, around 60 to 70. The need was seen for the world to be taken to a process of development in view of the poverty and the inequalities, serious inequalities that member states after the war were able to see in the situation, economic situation, social, environmental, and global. So the global agenda for development means a group of meetings and summits and conferences that were convened in the last 20 years, especially in the 90s. And because the United Nations were organizing their conferences, it was said, so that the world could improve in the 21st century. That means preparing the world for the next century. And these conferences created a world consensus on policies and activities for poverty eradication and the promotion of development. Because the concept of the development has been changing throughout the time, and those conferences provide a basic framework to achieve those objectives and development. One of the main consequences of the process is the Millennium Summit in the year 2000 that prepares with all the heads of state and government the Millennium Declaration, and together with the conferences that you see on the slide would represent the agenda for development of the United Nations that is shared by all the states. We have the conference on children in 1990, in 92, the Conference of the United Nations on the Environment and Development in Rio, which was an important conference in the sense that established the relationships between the environment and development, human rights, population development in Cairo, the conference on the women in Beijing in 95, the conference on social development in Copenhagen in 95, and finally the Millennium Summit, or the Declaration of the Goals of the Millennium, the Conference on Funding of Development in Monterrey, Mexico, and the Johannesburg in 2010, the Summit on Social Development, and finally 2012, Rio Plus 20, which is on sustainable development. This meeting, the title was Rio Plus 20, but the official denomination of the conference was Conference of the United Nations on Sustainable Development. And the final document signed by all the heads of state and government is on the future that we want. Defending and establishing and recognizing that sustainable development has three pillars: economic pillar, economic, social, and environmental, with very important relationships with economic development and environmental development, admitting global, national, and local actions on the basis of equality, eradication of poverty, and the reform of global governance of sustainable development and environmental development in order to guarantee the reality of the objectives, the goals of sustainable development. The future that we wish is a final document, a 53-page document, and 283 paragraphs, 9 of which refer to health. This document I will mention in my presentation, and you can see it on this site of the ENSP Fiocruz website, dssbr.org. All the documents that I mentioned in my presentation are in Spanish, English, and also in Portuguese. And you will see the site of the school of the Fiocruz and find all these documents. When I was the president of the Fiocruz, and we organized the World Conference on Social Determinants of Health. That is why we have this site, including all these documents. And that document of Rio Plus 20, The Future We Wish, is a guiding document for the Sustainable Development 2030, gathering the unfinished agenda of the goals of the millennium that showed the effort to achieve them in 2015 and have a new agenda with the goals that we will mention. So this is a process, with a very important moment in 2012 in the Rio Conference, and 3 after until 2015 we have the great process of building the 2030 agenda and the purposes of sustainable development. There are many agreements included and a governance process. During the General Assembly of the United Nations in September 2015, Resolution A70/1, Assembly 71, is the first revolution which is transforming our world, the Development Agenda 2030. And you had, as an attachment of the conference, a resolution also of the General Assembly, which is the Agenda of Action of Addis Ababa, which is the result of a conference on funding and development, which was organized in Addis Ababa, Ethiopia, in the year 2015, just before, he says, yes, in 2015, but before the September conference that approved the full agenda. And this process of the agenda, there is a recognition that there is a process with the commitment of the national state. Is a state-driven process with a participation that is planned, having stakeholders and the partners and also the organization of civil society. And it is working on governance of the global process, and therefore it was called High-Level Political Forum, gathering within ECOSOC, which is the Social and Economic United Nations Council. After the Security Council, the most important one, ECOSOC. Of course, the most important organ is the Assembly. And then we have the committees, Security Committee, and ECOSOC, that gathers all the countries around the process of economic and social development. And also this agenda deals with suggestions for governance of sustainable development, also at the national level. The agenda, I think that you may know this, but it is the third reminder that the agenda contains 17 ODS, among them ODS 3 on health, but it's not called health. It's guaranteeing healthy lives and welfare for all, which is very important. Each one of these 17 ODS, they have their goals to be achieved, results to be achieved, and the means for implementation. We had a total of 169 goals and means of implementation distributed in the 17 ODAs, and until March 2017, 232 indicators had been defined. That means to say the measurement of the implementation of the 169 goals. Health contributes with 9 goals of results and 4 means of implementation, and has 27 indicators. Is the sector having more indicators on the approach and fulfillment of the goals of ODS, which sustainable development. We are now working to perfect the negotiated perfective indicators, because we know that countries will choose their priorities within the idea of the national development plans of each country. Practically all the countries have defined the national development plan, and the question is how to make the sustainable development and the components to achieve its goal. The agenda with the purposes of sustainable development, you mean to say a mixture with the national plan. And this is interesting to understand all this so that we may, in the health sector, you may act in the dialogue with other sectors. Here you have the slide with the specifications and each one after the other, which are the 17 purposes of sustainable development. But I asked my people to organize this, to have this, which I think it is a reality which is nearer what in fact the objectives are. the goals are, which is more an interpenetration, as we see here, as a puzzle, and we have to introduce one into the other because the goals are not separated. No, the goals are mixed because we have health in 9, in 12, in 17. There is an interpenetration because development is an only process, and the goals and the targets to achieve these, we have to comply them harmonically, all of them, harmonically all of them, because this is not an isolated process with several sectors, but they are all together form an agenda for development. And this I call your attention because leaders discuss this in depth, and we also have to do it as the health sector in order to improve our health purposes, always thinking, as we will see, that there is an interpenetration in almost all the goals and targets. All the goals that are not related to health have an influence on health and welfare of the people, and this is important. And we always try to say that the other objectives of sustainable development are the social development of the social determinants of health. So to eradicate poverty, put an end to hunger, to achieve food security, improve nutrition through sustainable agriculture, which is to ensure a healthy life, promoting the welfare of all the peoples at all ages. Education, quality, and permanent learning for all. Gender equality and the autonomy of women and girls. The question involving the sustainable management of water and the air. This is related to Objective 3. So these are all interpenetrating objectives. This energy or power achievable, sustainable and modern in very poor countries. Power is really polluting in those small little huts that they live in, and also with the use of wood and with dangers to health. So that it's important to have healthy power and the power production with the fossil fuel also have terrible effects on human health, and showing the importance of one objective into another one. Eighth objective is to promote economic growth. Sustained and sustainable growth. Is it possible to sustain the growth all the time? And this process will have to guarantee sustainability. This seems to be a contradiction, and many people discuss this, but we have here the topic of economic growth and the employment and work. And this is a complex objective that we have to know in depth how this will take place in the region and countries. The ninth regards to industrialization, flexible infrastructures and innovation. It is very important also, this topic, because there is faith on technology and innovation. I am not so certain that the solution will come exclusively through technologies. I think we have to think about sustainability and perhaps stop growth and change strategies for the access of the population to improve their quality of life, and not exclusively with permanent growth, economic growth. We have to think in sustainables because the resources of the planet are threatened. Also, the life is dominated by our species, and today is the Anthropocene. The 10th would be to reduce inequalities within and among the countries. This is one of the most important ones that we have in the Sustainable Development Goals, one that contributes more to achieve health, equality, and significant reduction of inequalities. The 11th has to do with the cities and human establishment, concentration of diseases, everything that is mentioned on the topic of water, the resources of a city to be sustainable, including people and resilient, able to recover, and as we said, 11 cities and settlements, and the 12th to ensure consumption and sustainable production paradigms without aggression to the environment, and consumption has to be responsible and also sustainable production. The manner in which we are consuming, especially some countries like the USA and the European Union, where the most important number of welfare to the people is produced, but also in the two meetings they have the worst aggressions to the environment because of the use and the consumption that they have to rethink again for them to become sustainable. Also, the adoption of urgent measures to fight climate change and its impacts, because of the impact on human health. Objective 14th and 15th are related to the environmental topic, the oceans, seas and marine resources on one side, and the terrestrial ecosystems, deserts, degradation of land, and the loss of biodiversity. So we see the pillar, the most environmental pillar of the objectives of sustainable development. And finally, two final objectives that are the means, general implementation means, because they are the two objectives that contain the means of implementation, because each one of the objectives of sustainable development has their own means. But these two contain the means, as I said, of implementation, and which are the promotion of Pacific and inclusive societies, the access to justice for all, and here the topic of governance appears very, very discreetly throughout the discussion. I think this is an important word, in fact, which is the construction of efficient institution, inclusive one, at all levels, from the global, national, local. This message is important, but the topic of governance is, at this moment, but when it was formulated, these objectives, to my view, the topic of governance had a priority not as important as other segments and other formulations of the agenda. And finally, to strengthen the implementation means, as I said, it is an objective, a medium objectives are revitalize the World Alliance for Sustainable Development. The one which is more known is the topic of official help to development or assistance to development, which 0.7% of GDP of rich countries for fund in the United Nations for development, all the help, assistance that developed countries could provide to the less developed countries or underdeveloped countries. We are living today a crisis. We have had in this crisis 10 years of loss, which is produced by the central capitalism, Europe and the USA, and North America in general. The economic crisis in which they created also affected or impacted the topic of assistance for development and the financial resources to the Agency of the United Nations, the transfer of the contribution to the United States and their agencies. And as it is the richest country in the world, with a population of more than 300 million inhabitants, they had 22% of the contribution to the expenses of the United Nations. That means to say that would be a responsibility for the USA, and this problem I wanted to mention. Working very quickly, Objective 3 to guarantee healthy life and welfare for all at all ages. I will mention only that you see in yellow letters in the center of the goals is the reduction of maternal mortality. You may have access and see the responses, and to put an end to avoidable deaths of newborns and the younger 5 years and less, which is a large number of global deaths in these more fragile beings, newborns and 5-year-olds and less. These are one of the goals of the health objectives. And also to put an end to AIDS, TB, malaria, and tropical diseases, and fight against hepatitis, water-transmitted communicable diseases, and other communicable diseases. And here we have the chapter which is the reduction of premature mortality due to non-communicable diseases, including mental health and well-being. The take of abuse of drugs with crack and the permanence of epidemics and narcotics and alcohol. The topic of accidents, transit accidents, sexual and reproduction health, and in the 8th we have a very polemic topic, which is the universal health coverage. because the nations had a discussion when they were drafting the goals and the objectives, because our WHO, for them, would be to achieve universal coverage that would make too restrictive what we understand by health, reducing the development objective and reducing the topic of health only to coverage is not to recognize the broader concept of health and the importance of social determinants of health, and fail to recognize other knowledge with Ottawa and other conferences for promotion of health were added to the topic of health. So we tried to promote this topic to achieve universal coverage, including the equitable health systems, integral and quality systems. We try to have as a formulation this one in italics and underlined: through equitable, integral and quality health systems, because universal coverage may mean many things. We defended this concept in the same manner the access to health services. Not essential, because the concept of essential relates to the idea of minimum packages and the formulation of the 90s, for example, which was rejected in all the fronts. But to change essential by necessity and add medicines, vaccines and technologies, because you cannot face a disease only with medicines and vaccines, but we need technologies. But we cannot change the global, but we have to see that the formulation of the goals of the ODS 3, we have to have ensured the idea of health systems that equitable, integral, and not only a restrictive concept of universal coverage. And on the other hand, the question involving technologies that the epidemiological profile will define the necessary services, and not only some essential services. And finally, the topic of dangerous chemical products and pollution of air, water, and the soil, because this is important in the case of human displacement and mortality. To guarantee, in terms of the means of implementation, we had 4 agreements: the framework agreement for the control of tobacco, the research and development of vaccines, medicines and technology, and divided into necessary and non-essential. Necessary have to be with the topic of the epidemiological profile and guarantee the TRIPS agreement on flexibilization of the access to medicines, because they are becoming because poor countries cannot have access to medicines, and poor people do not have access to medicines. And this is a very serious reality, because the topic of medicines, we find the private interests versus the public interest. So the state has to define what is the need, what is the public demand. So there we have a very important conflict to be considered in the implementation of the 2030 agenda. And also the funding of health and the development of people and how to retain these people. Because in many cases, some countries lack nurses because these people study and then go to rich countries. So the important thing is to retain this workforce. And this is the reason of a treaty and of a contract promoted by the WHO to retain the staff in developing countries. And finally, the topic of epidemiological surveillance, and we would also add here, it wasn't the regulation of health surveillance, because we have the space in which health is in conflict with large great interests. And if there is no health surveillance and regulation and the obligation to provide medicines, if this doesn't happen, we may find many problems. So it is a formulation that we have to include in the agenda in our countries and in the development goals. What is it doing in terms of monitoring and evaluation of the agenda? There is a high-level political forum for the monitoring, evaluation, and guiding of the global process. And also it's made up of the heads of state and government and high representatives of member states of the United Nations. This is found in this ECOSOC, the Economic and Social Council of the United Nations, with ministers, or the General Assembly of the United Nations, heads of states. When the heads of states is made up of, the forum is made up of these heads of state every 4 years, and every year with this representation of the countries. And also the participation of the so-called major groups, local authorities, the private sector, workers and unions, NGOs, the academy, the scientific community and others, women, the disabled, the youth, indigenous peoples, and so on. These are interest groups that are part and that they have their participation and their voice listened or not listened in this political forum. This year in New York, in July, poverty, hunger, security, and sustainable agriculture was discussed. Healthy life and well-being, gender, infrastructure, industrialization and innovation, oceans, seas, and marine resources, and always the topic of governance. And for the 2018, we have already predefined the objectives that are going to be discussed. It will take place in New York in July each year. Which are the regional actions we have in our region? In Latin America and the Caribbean, you have the Forum of the Latin American Caribbean Countries on Sustainable Development. This is a very important initiative proposed by the member states of CEPAL, of the Economic Commission for Latin America and the Caribbean. It is made up of CEPAL and the member states, and it's for monitoring the 2030 agenda, the development objectives, the goals and implementation, and the funding. It has a doctrinary base that you may think, which is the CEPAL document Horizons 2030, which is a very important document on how we could transform the production, the topic of employment, development for our region. And in addition, I would suggest you to look for the report on development and regional challenges of the Agenda 2030, which was produced by CEPAL also for this year's meeting. You will find it in the webpage of the CEPAL. I recommend you to have a look at this document because it is very important information. The structure of regional integration of Latin America's UNASUR, the Andean Community, Mercosur, COMISCA, Central America, and CELAC, I think that all of them in our region, we are in the process of preparing and defining the positions to address this agenda and the objective of development. And in the region, we have the temporary presidency of Mexico, and we have to follow in detail the decisions and documents. But there is also an important pool of definitions that the sub-regions are drafting in the next years. And we will have in UNASUR that has a relation with this course that we are providing. And the actions in health. I mentioned the regional actions before in general terms. Now there are also actions in health for the region, which is the Sustainable Health Agenda, which is being drafted under it's 14 countries under the coordination of Ecuador to be presented at the Health Pan American Conference in September. The health strategy, which is a decision of the ministers of health of our countries, and a concept and a practice that we have to pay attention, and also the topic of health in the regional integration structure, including UNASUR. It hasn't been yet defined, and it is important for them to do it, and for us to do it. At the national level, we spoke about the global level, the regional, and now at the national level, the last document that came from the high-level political forum in June 17. The governments and the interested parties have to translate the goals and the world objectives in policies, programs, and national measures, making the defense that this is needed or needs a integrated planification, which is very important. That is to say, in order to achieve sustainable development in a very harmonic manner, planning is necessary. Planning, integrated planning, intersectoral planning, and multi-partners, multi-stakeholders. This is the important to have the state and the groups of interest and the society. This, I believe, is a very important recommendation made by the political forum. And I mentioned the importance of national plans of development and the Agenda 2030 that we have to monitor, and the dominant mechanism in our country, which are the national commissions of sustainable development that are already installed in all the countries with the participation of governments, of civil society, and other major stakeholders, major groups. Remember that some countries in our region last year and in this year, at the political forum of the community, they presented voluntary evaluation on how the topic of the 2030 agenda is doing. And in Latin America and Caribbean, You will find them in the site of the political forum. Argentina, Belize, Brazil, Chile, Costa Rica, Salvador, Guatemala, Honduras, Panama, Peru, and Uruguay. Voluntarily, they presented the development of the agenda in each one of these countries. Very quickly, to conclude, I would also like to speak about the relevance in the topic of objectives in the municipalities and local territories. This is important because this is not a simple reduction of the global policies, but a process which is based on qualification of local players and sustainable development with specific characteristics, giving an answer to the needs and aspirations of local life through sustainable development among the spheres of global development. But I call your attention because in addition to the national strategy, we also have the local and territorial strategies. Well, I just wanted to, on this topic of the ODS, Sustainable Development Objectives, I would like to show you this document, what local government must know. You may find it on this site, and you may visit and see this document. You have the site where most of the references that I mentioned. These are the recent bibliography. I wrote them very recently on the topic, and you will find it on that site also. And finally, I used for this class this document, this chapter of this book, Diplomacy in Health and Global Health, which the Latin American perspective is in Portuguese, but we are trying to get it translated to Spanish and English, but this will only take place probably in the second half of 2018, next year. So I invite you all to read this chapter that we prepared, that we wrote on health, on the 2030 Agenda for Sustainable Development, Central Policies for Global Governance. And in most of the comments that I made and in this chapter, thank you very much for your attention. And I am sorry for my Spanish, but I confess that I made a great effort to communicate with you. Thank you.